be here to welcome you to the California African American Museum and to join in your call to unveil sickle cell. This is an issue on which I've worked for a long time, and I've seen the movement for better identification, more rigorous detection over literally the last 20 plus years. And we will continue to work on this issue. One of the areas in which I work in the California State Senate is on the Health Committee. And there is a select committee on the healthcare crisis in the county of Los Angeles, of which I am the chair. And many of the concerns we have is to make sure that the quality of healthcare and the delivery of such services is elevated for the benefit of patients across the board. One of the areas that obviously in the second supervisorial district where we are currently located, there's no doubt a higher proportion of those who are carriers of sickle cell, and therefore we have a specific responsibility to work to do all that we can on your mantra to unveil sickle cell. So you can simply count on my continued advocacy in this regard. One of the big areas that I've been advocating is school-based health centers. If we have more of them, they are cost-effective, they are efficient, they are smart, they are preventive. If you have school health centers, when I was in elementary, junior high, and high school, they essentially had a nurse's office. They had a nurse there full-time when I began. By the time I was in high school, the nurse was there every other day. Now we are going back and getting smarter to say that if you want an academically successful child, you want a well child. If a child is sick, challenged with any range of health maladies, the likelihood of that child experiencing the highest level of academic achievement is limited. It is diminished. Therefore, I am the author of several pieces of legislation that push for making sure that we have school health centers right on the campus where youngsters can go and be screened and cared for. And the important thing that I want to leave with you on this connection is the following. Many of the cases that are being viewed now with the visits to the school health center happen to be those youngsters who are seeking not STDs, sexually transmitted diseases, not upper respiratory problems, not ENT-related issues, not problems with the eyes and so forth, but mental health issues. From 40 to 60%. Mental health. Depression, abuse, and higher orders of challenges. This is very, very serious. But in addition to that, we want to make sure our young people, our students, our children have the opportunity to be screened for matters such as sickle cell. I have put a lot of time in working on passing legislation related to lead poisoning, another blood-related disorder, and many of which is irreversible, right? And so we work on a number of these issues in the area of health, and I'm here to say that my interest in this is in the interest of the well-being and the health of our community. We have to work harder on this issue. It's not a question of childhood obesity and diabetes alone. There's a range of issues. But if we have these school health centers right there on campus, working with the students and their families, we have a much better chance of succeeding. And so let me just say thank you for the opportunity to come and greet you today. Sickle Cell Awareness Month is important, but we have to make awareness of sickle cell a year-round issue, and to make sure it's higher on the agenda for the Department of Health Services in the County of Los Angeles, where there's regular education, sustained advocacy, so the issues and the diseases that affect a particular population are not forgotten. It will be forgotten if we don't advocate, and I'm here to say to you, you can count on me to advocate on behalf of this particular malady, and thank you very much for this opportunity.